Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. CeCe, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Annah Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. CeCe, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Annah Kate, your medical mystery overachiever and discovery liaison, and we are back with another mini-sode about one of my favorite modalities of healing and just overall health. So whether you have a chronic illness that you're dealing with, or you're just an athlete or just a human being, we're going to talk about something that's really cool that everybody can use.
Yes, and that magical mystery of a modality is pulse, PEMF, or pulse electromagnetic therapy. It's something that we use in the office all the time. Pulse is just a really wildly awesome wellness tool that, like Anna Kate said, anybody can benefit from it, but especially if you are dealing with a lot of chronic inflammation or chronic pain. But it is basically these pulse electromagnetic fields, they stimulate the body's cells and they exercise those body cells as well. So the earth emits this pulsing electromagnetic, still can't say it.
Pulsing magnetic electric field.
No, you said it backwards. Electromagnetic field.
Same difference.
So take two. The earth emits a pulsing electromagnetic field at 7.8 hertz. And by take two, we are not cutting that out because we don't do that around here. And this natural energy field allows for our planet to sustain life. We need that to sustain life. And much like the earth, our bodies are electromagnetic, and our brains utilize these electromagnetic signals to communicate with literally every body system. So science, and this isn't just like hoopla, this isn't stuff that us quacks in functional medicine kind of pull out of our, you know what, this is scientifically proven that our cells, if they have enough of that electrical charge, they can heal. Because when we are, and we talk about this in terms of grounding a lot, as we are electromagnetic beings, that frequency is shifted very easily by our everyday life. Everything we're surrounded with shifts that frequency. And when our cells get distressed and shifted out of that frequency, we can become symptomatic. That's why it's so important to ground and bring ourselves back to that baseline where our cells are vibrating at the frequency that they're meant and designed to. So pulse, the essential being of pulse is that it helps do just that. Helps bring your cells back and your electromagnetic field back into harmony and equalizes it. So who is it good for? Everybody.
If you're a human being.
If you're a human being. One thing that's really good for is pain management. So pulse has been associated with pain relief in arthritis and musculoskeletal disorders and chronic pain. And it's non-invasive. So it's just a why not? Why not try it? You need a good technician who knows the frequencies, and because there's different settings. And let me say here, actually, not all pulse beds are created equally. There are a lot of PEMF beds out there, like on Amazon, and they're expensive. They're like a couple $1,000s, but they do not have the literature and the research behind it as the one that I prefer.
So if you can get on a pulse bed, which is a specific manufacturer and maker of this, there's a dramatic difference than something that has a very lower it may have PEMF, but it's not the same that delivers
it's just not the same grade
hers does.
So we use Pulse Centers of America. They are like the old OG. It is a wildly, insanely expensive piece of equipment, but there's chiropractors out there that have it. There's offices, orthopedic offices out there that have it. I'm just saying, to me, it's not always if you can go to a clinic that has that Maserati of a pulse bed, I would not waste money on a pulse bed that you can have or a pulse mat you can have at home, because I've just never seen the impacts as I have with the machine that we have.
Right.
Where someone is like, wow, yes, after using it, 3 or 4 times, my joints feel better, etc.
Right. So it's kind of like, so here's an analogy how my brain thinks of it. So you can get hydrated by drinking a glass of water, or you can get hydrated by getting an IV infusion of all the things that your body needs when your body's off kilter. Yeah. So yes, earthing and grounding and, doing those things are great, but there's pulses on a different level.
Yes. And then there are like mats that are readily available for you to have at home that I have just never seen have the effectiveness as the specific piece of equipment that we are talking about. So just keep that in mind in terms of what you spend your money on. But a lot of kind of going back to the joint pain, a lot of athletes will use PEMF to enhance muscle function or to improve performance or just help them recover and reduce that recovery time. And a cool story that I have with Will is that
Will is her husband. If you didn't listen to episode
hubby.
5, go back to listen to episode 5.
That is hubby. And he, oh gosh, maybe 3 years ago now at this point. So Will was 2 weeks away from a fight. He's an MMA fighter. And in MMA, you need your arms, right, to punch people in the face, okay? And do a lot of other things. But your arms are very important. Well, he tore a ligament in his shoulder 2 weeks before a fight in his right shoulder. And he couldn't lift his shoulder past like a little chicken wing. He had no range of motion. It was extremely painful. And he's 2 weeks before a fight. So there's nothing invasive that we could do at that point that would help him. He's also very stubborn. So he's like, no, I'll figure it out and I'll fight one-handed if I have to. I'm like, this is not ideal. Anyways, he laid on pulse. He had to leave. He usually leaves about a week before a fight. So we had like 6 days of wiggle room where we could do something. He laid on pulse every day for an hour for those 6 days, and we concentrated it. So there's a bed that you can lay on if it's more global, but there's also little paddles or pads that you can use to localize that electromagnetic field to where we need it to be for sites of injury. So we put it on his shoulder for 1 hour, 6 days in a row, and he went out and fought a week later. Full range of motion, no pain, no rebound. So it's not like a steroid shot where it feels good right then, but then you are crippled.
The injury is still there.
Yeah, the injury is still there, and you are now in worse shape afterwards. Nothing, no injury afterwards, no inflammation, no physical therapy. 6 days. And he went out and fought a whole MMA fight.
It's magic.
It is. It's just wildly healing. So anyways, the other in terms of, and to that point, it's so healing because it stimulates that cellular repair and regeneration. So it's not masking it like a steroid shot would do, or just reducing the pain locally like a steroid shot would do. It's actually regenerating the cells in that area and promoting faster healing of injuries, and especially post-surgery is a really good thing too.
So does it go in, so cells that are damaged, does it help further break them apart so your body can eliminate them? And
heals them.
Okay, so if it's so it heals the broken ones.
Yeah. Okay. It heals the broken ones, and it's very similar with inflammation. There's so many studies on PEMF and reducing inflammation in a variety of tissues and helping with circulation and blood flow. Sleep is another one. Improving quality of sleep and our circadian rhythm, and just promoting restorative sleep. I mean, the benefits kind of go on and on and on. I have patients with like osteoarthritis, or just arthritis in general. But to your point, actually, this is a good point. Cellular detoxification, it does have an impact on as well. Yes, it can regenerate cells and heal cells, but it also can support cellular detoxification and the removal of waste products from stem cells.
That's the question.
Yes.
Okay. I just didn't say it right.
From your cells.
Yeah. So I have another question. So we were talking about arthritis and joints. So what happens, how beneficial would it be if, let's say, you broke your leg or you broke your arm, or obviously after surgeries, hip, knee, shoulder replacements, this is a great modality to help get you back to, you know,
Full functioning.
Fighting a,
For
it's
those of you
not
who
fighting
fist
weight.
fight.
It's the, I don't know. Anyway, there's a word. You know the word I'm talking about.
I don't.
But anyway, so if you break a bone,
Yes.
or, I mean, especially a femur or a leg bone, can this be beneficial to help repair bones?
Yes. So there is a really cool study that, I don't know if I should say this, but I'm going to. So this company that we go through, they used to have this booklet of all these studies that we could read. And for whatever reason, they now can't release those studies. Our government. Anyways, FDA. So, but these studies were so immaculate that it was proven to heal a broken leg bone in 9 days.
That's
And
nuts.
scientifically proven.
Yeah.
Yes. And so absolutely. So timing post-surgery really matter. If you are going through surgery, right, you're inflamed. I mean, you have lots of localized swelling, you have lots of bruising. So if we go through like a dramatic hip replacement and there's rods and all these things,
Right.
I recommend waiting until, at least 2 weeks post-op until things kind of settle down.
Mhm.
Your immune system kind of settles down with those local sites of injury, with the stitches, all of that.
Yeah.
And then it can be a really awesome modality in conjunction with like your physical therapy to help you get full range of motion better or faster, to help get the more chronic inflammation down more quickly, etc. But yes, it has been proven to literally help heal bone.
Beautiful.
Which is wild.
Yeah.
Not to mention the neurological side of things. It has shown to be extremely neuroprotective and to impact any sorts of disorders that, come from the central nervous system, stress reduction. They're just endless.
So if you have an elderly, a senior, not elderly, someone that has worn out their joints in your life, if they have surgery or anything, get them on the pulse bed. If you have student athletes that are in contact sports or any sport in general, I know you played volleyball too, didn't you? Did you play volleyball?
I played soccer and basketball.
Okay. So those are not technically contact sports, but there's a lot.
Soccer?
Well, basketball and volleyball are not technically contact
basketball,
sports.
yeah, I would not consider.
Like girls soccer,
but
and
soccer,
and
I would consider a contact sport.
So there are those things that you're putting a lot of stress on your teenage body. That this is a great restorative, just to get them in once a week or twice a week on the bed, especially during their seasons.
Like non-invasive, safe way.
Yeah.
Absolutely. And yes, the timing varies. If there's an acute injury that we're trying to heal quicker, every day for an hour, if that person can tolerate it. If it's someone who just needs maintenance, once a week is awesome. If it's someone who is kind of on the verge, twice a week is great.
Yeah.
And you start low, you go, you build up depending on the person to see what you can tolerate. But again, it depends on the technician. They have to be well-versed in the timing, the frequencies, etc. But yes, just doing kind of a general 1 to 2 per week is really, really wonderful for wellness.
So get your kids on it if they're in contact sports. One for brain health and just maintaining their muscular structure as well.
Exactly.
So what else do we want to talk about? Anything else we want to talk about PEMF?
No, I'm a huge proponent of it. I love it for my chronic patients who need, it's something that I use to help heal post whatever is going on, and we've treated a whole bunch of things, and it's a great modality 2 to 3 times per week because you can't remove physical damage after you have removed the problem biologically.
Right.
So it's a great modality to come on for those patients, but also just anybody for general wellness. We all need that cellular kind of reset with all the technology, all the free, just everything we're surrounded by. We all need it. So
Is it safe during pregnancy?
No, okay. So would I say it could be safe during pregnancy? Sure, but there are no studies in pregnancy, so they cannot say that you can do it while pregnant.
Okay.
Yeah. So
just a question.
No, I know.
But I'll say for mom and baby, whatever that is. But
yeah, it's just, it goes based on studies. And if there's no studies to show that it is safe, there's also no studies to show that it's not safe, then they just can't comment on it in general. So they're just like, no, not for pregnant women.
So after baby gets here, all good.
Yes, Oh yeah, I lay on that thing all the time at work. All the time.
Yeah.
If I have 10 minutes in between patients, you will find me laying on it.
And your feet on the...
Yes. And my pink Himalayan salt dome. Oh, it's so nice and just grounding and warming, and it's wonderful. But anyways, stay tuned. We have another good kind of wellness modality coming up on our next little mini-sode. So stay tuned for that and all the other random things that we've been talking about. We hope that you're just learning little tidbits on the go. And until next time, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.